Okay, incredible. So, thank you all for being here today. This is the fourth installment of the Gender Health Equity Program, as well as we did just have the conference for the Feminist Health Conference. So, again, kind of those two are hand in hand, but we're really, really excited to kind of keep moving forward this program. We have a lot of really exciting speakers and events lined up for next year. So, definitely be excited for that. Today, I have the absolute pleasure to introduce Dr. Dosanjh, who is an impassioned visionary leader and is the current president of the Federation of Medical Women of Canada, as well as has recently spoken at the UN Commission for Status of Women on Gender Equity. She has previously served as president of Doctors of BC, where she played an instrumental role in BC's recent healthcare reform and primary care transformation in BC. She also created the first of its kind Health and Justice Alliance, an intersectoral allyship between doctors and lawyers to help transform the family justice system. She has recently also been appointed to the Collaborative Strategy Commission for Transforming the Family Justice System. In addition to all of this, she has also served on the Physician Services Committee, the BC Coroner's Service Illicit Drug Toxicity Death Review Panel, and the inaugural Provincial Digital Health Leadership Committee. She's also the president of BC Family Doctors in 2018 to 2019 and has initiated the formation of the Provincial Child Youth Mental Health Substance Use Committee Community of Practice and served on the Child Health BC board for 4 years. Aside from all of this, she's also a mother to three daughters, an author, family doctor, and hospitalist. And she is fiercely dedicated to social justice, healthcare equity, and disrupting systems by challenging the status quo. So please help me in welcoming our incredible speaker today. Thank you so much for being here.
Thank you so much for having me. I am incredibly enthusiastic about being amongst all of you wonderful leaders. And so, whatever I can offer today, I really want this to be more of a dialogue and, question, learning, sharing. So, this is just, I want it to be as informal as I can, but I'll just go a little bit through myself, introducing a little bit of my work and the work that we're leaning into and the spaces where we can really empower one another and create solid connections to change our futures. So I also want to recognize that I am joining all of you today from the traditional unceded territories of the Tsawwassen First Nations and Musqueam territory, where I am lucky enough to live, play, and breathe every day. I want to start with my cover slide is pioneering for change and how to advocate for equity. I don't need to be necessarily telling you exactly what the toolbox is because you're all in the spaces that you're in today, but I like this lens of seeing some of the incredible women and forces that have come before us. And you may recognize some of them as physicians, as leaders, as Harriet Tubman, Sojourner Truth, some people that have done some radical movements and revolutions and created space for all of us to be where we are today. And so, with that, I just start the day in the morning with gratitude for all of the fearless trailblazers before me, but also amongst me today with all of you. And never forget your own individual power. But again, I'll get into a little bit of that as we go on forward. I love this quote by Bell Hooks, just talking about beloved community is formed not by the eradication of difference, but by its affirmation, by each of us claiming the identities and cultural legacies that shape who we are and how we live in the world. So whether you're Canadian, whether you're American, whether you're an international global citizen, I think it's really important to know that we all have differences and nuances, but bringing together our visions and values that overlap, especially for co-creating wonderful spaces for humanity, we have to remember this. This is me. I put a picture. I often have a picture of myself. To remind me of where I came from. Humble beginnings. I'm a child of immigrant parents who migrated to Canada in the 70s. And both my parents, being immigrants, really struggled with that immigrant interface. But without acknowledgement of where I came from and my history, it's really hard and difficult to acknowledge my present moment and how far I've come and how much work I still have left to do. This is probably my most racy disclosure, intersectional feminist. I'm sure many of you can relate, and it makes me comfortable that I'm amongst colleagues and friends and peers who may feel similarly. But sometimes this can be the dirty F word in the room. But I just like to declare it first and foremost. Why are we talking about equity? Why is it important? We know that feminism is for everybody, and as often as it gets misconstrued, especially in the social media or in the public spaces these days, we know that this is the framework and this is the movement that actually enables the most equity. Here we go. And of course, it's a freedom from bias or favoritism, which we know this can be difficult in many of our spaces, but that's the textbook dictionary definition. And when I speak of equity, we talk about healthcare equity, but healthcare equity can't happen without racial equity and gender equity. And so oftentimes people will say, okay, talk about healthcare equity and healthcare equity now. If you guys are familiar, it is the fifth pillar for the quintuple aim in, especially in healthcare, creating dynamic change. And for me, it's one of the most important pillars. And to substantiate anything we do in medicine and healthcare, I truly believe that it needs to be where the roots are planted that enables access for everyone to equally access healthcare. With it, we also know, of course, because of historically where we've been, gender equity has been disadvantaged, and we also know our current landscape and racial equity and inequities have definitely been plaguing this space. So we know that this is what the definition of healthcare equity is, that we have people that can access affordable, culturally competent healthcare. I say this because we need to be inclusive of our marginalized populations, of our Indigenous populations, and how they would like to obtain healthcare and what it means to them. So this is trying to be an inclusive meaning, regardless of race, ethnicity, age, our ability, sex, gender identity, orientation, nationality, socioeconomic status, and our geographical location. So these are all the factors we're talking about in the healthcare equity space. This is an interesting graphic of Frida Kahlo, if any of you are familiar. But what, she used to paint these, this is a reproductive justice and a reproductive rights picture, which for me has a lot to say, which is synonymous with our geopolitical climate right now, but also that lends itself to the healthcare equity space in the framework of body autonomy and agency. Again, racial justice, I probably don't have to explain to all of you what it means, but again, to embed the systematic and proactive fair treatment of people of all races, resulting in equitable opportunities and outcomes for all. And it goes beyond just anti-racist frameworks. And it's not just the absence of discrimination and inequities, but also the presence of deliberate systems and supports to achieve it. So we'll talk a little bit about that and what that means in our own communities today. And another gift, in my opinion, Audre Lorde, and proclaiming that there's no such thing as a single issue struggle because we do not live single issue lives. Again, leaning itself into the intersectional frameworks and why the work is so important that we're doing in healthcare equity, embody gender equity and racial equity. And I think, again, all of you are very familiar with the gender equity space, so I don't have to reiterate this, but also ensuring that it means addressing the inequalities that may limit a person's ability to access opportunities. And then we come to why we're here. Who does this include? I'll speak a little bit about representation and why it matters. So when I talk about representation matters, so it means our own individual representation and what we bring to the table. So remembering your history, remembering your own intersectionality. So when you're doing this work, reminding yourself of what other sections that you could actually represent in this space. And knowing that visible representation matters, but also invisible representation matters. So having people aligned that understand from the lived experience, because one, their values and and what they've lived, their experience is being different, but what they add to the work. Traditionally, a lot of our hierarchical colonized systems in decision making, we do see affluent white men populate many of the seats, especially in leadership spaces. And this is not to us and them, this conversation, but this is rather to form bridges of allyship. I absolutely know the work that I've done in the spaces that I've been. I've definitely been one of the only visible minorities and definitely one of the only women in many rooms have decision making. And have been surrounded by white men with affluent status who didn't know any different and have just been doing what they're doing. But for them to understand what representation truly matters, as opposed to tokenism or being called into rooms just for meeting certain quotas as opposed to really definitely having an impact because of what you share and your experience leans itself into the work. So that's what I'm speaking about the representation. So obviously, also, the other thing that I learned a little late in this process in my own leadership journey was until people saw me visibly representing them in leadership spaces, they didn't feel like they belonged. So now realizing that this door that we've opened by our own representation in a space sometimes can be heavy to be holding that door for representation open. But what we need to understand is that heavy opportunity, it comes with responsibility, yes, and it comes with accountability, yes, but also brings a wave of people and potentially even a generation of colleagues or peers or mentees with you. And so I always want everyone to remember that sometimes what we may not even see for ourselves, other people may see and lean into that space. So being cognizant of all of your own intersectionality that you bring to your work. People often ask me, oh, when do we need this done by? And yes, yesterday. We know that many of our spaces that we're in today, myself included, I am the president of the Federation of Medical Women in Canada, who just celebrated its 100 years. I definitely wouldn't be here without the women and the trailblazers that started this federation off, because before them, women were not allowed into medicine and women were not allowed to into spaces to even assist in medicine and necessarily be the surgeons. And so having an opportunity to do all of this work and being able to be a part of medical history in the sense of leaning into a space where we're graduating more women than ever before and having women in all spaces and all specialties and influencing healthcare frameworks, definitely understand this very well. But we have still quite a bit of work to do. And as we'll lean into today, we'll also understand that there have been many spaces and doors that have been open to us, but again, not truly representative and not truly with our voice, framing the leadership frameworks that currently coexist. So I asked for us to do the work now. And what does now look like? Now in this moment, and we will speak a little bit about this of how we can in our individual centers and where we interact and have the ability to influence those around us, but also in spaces that are bigger than us, in communities, in countries, and as a global citizen as well. And where? So basically, equity belongs everywhere. And if you ask me, when people ask me, why do you do the work you do and what spaces that you infiltrate, I truly believe spaces of justice, education, and healthcare all lean into one another. And I truly believe that these should be nonpartisan places. So places that are free of politics and the governance structures leaning into the citizens that hold it accountable rather than people that are elected officials that are making decisions for us. And I'll speak a little bit about that when we get into how do we construct change. But really, in all of the places and spaces that we occupy. So another thing I want people to lean into is you may not think that you have an opportunity to make a change, but every change forward is a change. And I want people to recognize that. You may think, I'm in this little space here, and what am I going to influence? And you would be incredibly surprised on how much influence you truly do have, even one clinic at a time, one school at a time, one hospital at a time. Because if you can create this ability to network through the strengths of changing the archaic frameworks into, flatter hierarchies or more areas where you involve the people on the ground and the people working in the spaces, you'll realize really quickly that there's a lot more people that are with you than against you. And so today we'll talk a little bit about how, and I won't reveal all of this yet, but we'll talk a little bit about this. And again, you're going to hear, I'm sure you've heard this over and over, is the feminist framework and why? Because truly the feminist framework embodies equity. And this is what we've been talking about, whether or not it's really well accepted everywhere, but we understand that this is exactly what it means, is that we need to have spaces where we promote equity, but also where we influence structures that bring up this work. And so how does this come about? How do we go about equity and how do we make change in the system? And that's a question I'm often asked. And I believe it's power structures. And the reason we are in its current constraint or current environment is also because the status quo has a considerable amount of power that has been maybe more of a dominating power. And when I speak today, I don't want to be not conscious of the space that we're in or the geopolitical climate. But when we lean ourselves into power, we do have to look at the dynamics of power and traditional dynamics of power where, I may use terms that are, colonization or decolonization. And what does that look like? And why do we confront those current state systems? And a lot of it is power dynamic and power differentials. And when we look at the gender equity space, we also notice that there's a considerable power dynamic and power differential that has unfortunately shaped their current day reality. But the best thing is that we can turn power on its head and use it to our advantage. I also love this Alice Walker quote, and the most common way people give up their power is by thinking they don't have any. So even ourselves, even as siloed as we are, we have considerable power. And some days, I will be honest with everyone, that there are days that you feel defeated. There are days that you feel that, what am I doing, this one person in this vast space? And I will remind all of you that that's all natural. Those are normal human moments. But because you're even contemplating that fact, that alone gives you so much significant power. And so we're going to talk about how we harness our power, both as individuals, but more so as a collective. I think you have a unique opportunity that we're all here today engaged on this incredible Zoom that's been brought together, and all of you with all of your intellectual attributes and your ability and fondness to change the world. I feel oftentimes I get framed as a delusional optimist. And a lot of my friends and my colleagues and my coworkers will say, you have this strength, whether it's a strength or whatever it is, it's being delusional optimist. And I think that's how I've led my life. And that's the only choice I've had, is that, current circumstances may not lean it such, into spaces where I feel that the world is such a wonderful place. But the fact that we know that there is active work to be done, and now more than ever, we have an incredible piece where we have technology to unite us from all different walks of life, from all different communities and countries around the world. We have an incredible opportunity to really harness our power and to continue that way. So I believe in the powers of influence and empowering and challenging. Talk about that. And how we use our power. One of the most important ways where we can use our power, especially in medicine, I'll just talk a little bit about medicine, and we talk about evidence-based medicine, for example, and in the healthcare space, a lot of our decision making is based on data, and data will be research and truth. So I think the most important thing is showing people what matters. And that's why data and research has been so integral and important in moving the system along in healthcare, is that now we've got data-driven outcomes where we know we can say this is healthcare framework is racist, or this is the implication of doing this versus not doing this. So speaking truth in those spaces and using your voice. So I also will speak a little bit about upstandership. So if you're seeing something going on, it's part of our civic responsibility and our duty to speak up against it. and especially in spaces where we know that there's harm being done. So being conscious of the work that we're doing in our space when we're doing work to harness our collective efforts in healthcare equity. This is one of the most important tools, and it's to just speak it out and making what I'll say is the invisible visible. And I will attest this is very difficult as a solo person coming forward. So the importance of building alliances or coalitions or safe opportunities in spaces where we can discuss this is very important, because no matter what work you're doing, it's really important to embody self-care. And what that means is sometimes these spaces can be very difficult because you are a lone voice and you don't know who's with you, especially because there's so many people silent on many issues. What I've learned over the years is that when I stand in truth or when I'm speaking the truth, it will resonate on so many levels with people. And sometimes they just don't have the ability to use their voice. So this is, again, trying to create a space where we can allow people to be in a safe space and share their own experiences. Because oftentimes, just because it's silent doesn't mean it's not there. And influence spheres. So we know that most changes that happen are within our own circles of influence. And oftentimes it's been studied by many of the leadership giants in this space that influence is by the 5 people that are the closest to you. And whether that's your family, whether that's your neighbors. So really considering that to be part of your influential sphere. But also, if you're in an opportunity, if you're in a position of leadership, or whether it's, you could be the leader at your local school or community or organization, and you're the lead, but using that influential channel. And I say this not just in your professional spaces, but in your personal spaces. There's been so many times that I have a very vast ranging group of friends, but we'll have really interesting dinner parties. We'll lean into one another. And that's a great safe space for myself to really test some of the ideologies that are in the space and to think about the influence of people that I love and care about and what is their perspective, because allowing those spaces for me to be able to be safe and say what I feel and leaning into why it's so important and why it's everyone's responsibility in this space, especially when we're creating equity and healthcare equity or gender equity, is to remind people and also nudge them into those thoughts that you have in implementing in the real world. I also will say that use your voice of influence. So at all tables, in all spaces, social media is a great way. We know that there's been quite a substantive amount of negative rhetoric. And recently, I don't know if any of else of you have been in that space, but I had a unique opportunity in the last couple of years to be part of the group that says how to write to change the world, and learning so much in the journalist and background from people that are in the media space is really interesting, that only 20% of women's voices actually are represented in real-time media. So I think using social media as one of our big channels of influence for the better is something that I would love to build into, and actually want to hear a little bit more of your thoughts on, because even as I raise my daughters and I see the influence that comes through social media, whether it's TikTok or the Instagram or whatever ways or channels that people are tuning into, it's really important that we create a strong narrative fiber there. Because what I do see is it's very extreme at sometimes and leaning towards philosophies that are not in favor of equity, that are not in favor of women's rights, that are not in favor of racial equity. So these people got popular because this is what the information they've disseminated to people that are thirsty for knowledge. So I say this because recently, in some of the decisions in the geopolitical climate and the spaces have been made and influenced by people that show up for people that are wanting to know or having a sense of belonging. So I truly believe to change the narrative and the rhetoric that exists in the wide open space right now, especially in the social media space, means that we need to take up space and make socially responsible decisions in where we disseminate important information. And I never thought that there would be a time and a place and a space where we needed humanity to come together so often and to share our common vision and our common values and our humanistic factors that make us wonderful, and at the same time embrace our individuality, but a way to come forward for changing the world. And I'm hoping our future generations are also thinking in a different way in order to impact society as a whole. So that's something I really want us to think about and talk about. I spoke a little bit about our small spheres of influence and how they lean us into larger spheres of influence. And you never know on who you're going to impact. And so even if you're around people that may not share the same values sentiment as you, I think I have many friends that may not politically align necessarily with me, but understand that if I'm a caring citizen and the change that I'm trying to co-create is meaningful and will impact society as a whole, there's a lot more input into that rationale. And I'm not saying that we need to bring the whole team with us, but there's a lot of people in middle ground that just need to understand the why, and why are we doing this, and why is it so important. And unfortunately, some people are in a little bit of more of an individualistic climate where they need to understand how would this benefit them, or how does this help them? And if we can create a dialogue or a space where we can share the impacts of humanity and the governance of the world and at a whole, then more people will understand what the change we are doing. And leadership, every day in the spaces that you are involved in, there's an opportunity of leadership, whether that's mentees and being a mentor with mentees or reverse mentorship. There's absolutely such a dynamic influence in these relationships. And I am so fortunate to work still with my learners, my medical students, and my residents, where I learn so much more about the world. My kids, their friends, understanding their views of the world and really being engaged in that sense of leadership, but also pulling people up with sponsorship into spaces where there needs to be representation. And again, working on the dynamic of making the invisible visible. I love Toni Morrison and a lot of the work that she's gifted to this world. But really, this is the work. And when I talk about sponsorship and mentorship, I truly take this not lightly. But if we have been given an opportunity or have a trajectory where you've claimed an opportunity to be able to influence and you've gotten out of a position, then I feel the need to ensure that I pay that forward. And that's by empowering someone else and lifting other people. And for me, it's not just one or two people, which is wonderful because you're still contributing as a whole. But for me, it's try to bring a group of people to continually challenge the status quo. How do we empower one another? I believe that there's many levels of empowerment, uh, obviously through our own communities and where we interact the most through organizations. So there's many leadership organizations in this space where I always encourage people, if you're going to go sit on a board or if you're going to get involved, ensure those values are representing what you believe in. Because the most difficult thing, and again, speaking a little bit from experience, is to be hitting your head against a wall where they just don't understand and just don't see, which it's very important for some of us to do that work because eventually that wall will fall and eventually that wall will start to break. But that takes a considerable amount of energy, and especially if you're doing that alone. So I think even if you're doing that work, ensuring that you're in safe spaces and part of collaborative organizations where they actually let you live your values and your truth, that is really necessary because you absolutely need to be bolstered in support. And if there isn't an organization that you feel that truly can represent you, then you create it. I'm a big believer in coalitions. I'm a big believer in soft revolutions. Um, Building it together and harnessing your power, meant to scale and meant to involve as many people as we can. I truly believe in this concept, and I've seen it happen right before my very eyes. So if you feel like there's a cause that you're really impassioned about, or and it aligns in a certain framework, gather up your people, um, and bring them along. Raising the bar, I think the expectations, oftentimes in spaces, and I say raise the bar because I am very cognizant of the role I play. One of the most important roles I play is mom to three young girls. I have a teenager and two pre-tweens, and constantly understanding that my work has to raise the bar for them. And that's one of my most important things that I live and govern my life by, is the legacy and the impact that I'm leaving this world. And some of you may or may not have children, you may have siblings, you may have neighbors, you may have loved ones that are younger than you, but understanding that what we're doing, the ask of humans around us and those that participate, we have to raise the bar in order for them to participate in the world that we want to co-create. So creating standards, and I think that's really important, even within organizational front. For example, I'm working on a project also right now with this anti-Indigenous specific anti-racism project, because we've had considerable amount of racism, especially when we're trying to do the work of truth and reconciliation with our Indigenous peoples here. What I realized is that, this Truth and Reconciliation Commission came out so long ago. We've got all of these things that we need to be doing, and we're not doing it. So what we have to do is raise the bar. We have to create a standard in which its protocol and standard is to be anti-racist. And if not, same way that we would follow another standard or a guideline and anything else we do in medicine and hospital accreditation and all these things that are very important for our livelihood, is the same way that we need to keep people contingent on the type of behaviors they're having that are creating these uncomfortable situations, or not in the movement for an anti-racist movement. So that's what I mean about raising the bar. Mentorship, I already spoke a little bit about. Allyship is really important. And when I say allyship, is again, these spaces where there are people that may not look like us, may not necessarily think like us, but trying to create bridges where people can actually be listening to you. They may not have to agree with you, but listen to you, and the fact that this argument that you're raising is actually important for the betterment of all and not just one of us. And again, ally is not a noun, it's a verb. So I constantly remind my allies about this, that it requires action from them. Their inaction is basically worse for me than their action. So when I need something done, oftentimes I need them to stand up and their voice to impact and matter, because I know at the end of the day, unfortunately, in some of the rooms, and most of the rooms that I've been in, if a white male with affluent status says something, it's more likely to be given credit and more likely to be held as or regarded. And so sometimes you have to play the game. And that can be difficult, because even myself, sometimes I don't want to play the game that way. I want people to understand that, we have just as important something to say. Well, we know the climate is not necessarily receptive to that. So this is part of the game playing. And I have some amazing allies, which some people would never even guess that they're my allies, but they've definitely been my allies, because the actions that they've taken or the upstandardship that they've stood for has considerably changed the way that we do things. So this is a reminder. And when I come to challenging ourselves, is a self-awareness obviously begins with our own identity. I started at the beginning of this just with a picture of myself, of just reminding myself of what my bias is, whether it's my conscious or unconscious bias. What do I bring to this work? What do I bring to this world? How do I see this? And Why is my perspective different? I need to lean into myself to understand myself so that I can understand others. And a lot of my work and my challenging has been challenging my own ideologies and why I see the world the way I do, and why is everything an inequity as opposed to an opportunity. So understanding your own self in this space and the spaces that we lean ourselves into. Structurally, challenging the structural setup. So a lot of this work, when we understand, is that unfortunately, there's a divide and conquer mentality. And if we look at historically and we look at current times, many of what we're seeing, even in the geopolitical climate, the structures have been set up for us to be on a hierarchical, top-down, power, domination, differential, colonized structure. And so when we look at where those were created and why, oftentimes there was just a blueprint that got shopped around, and this is the way we do things, and this is the way that things happen. So for us to look at that in its own space and challenge at every little space and opportunity to kind of break away from that. And I know there's been a lot more literature and a lot more research and a lot more available for us to be able to combat these structures with evidence or with research. But I really think the most important thing is to bring the people with you in these structures and for help them to understand that this is not serving our greatest purpose. And especially in heavy institutions academically, you'll look at, if you look at the Harvard Business Review and how they think that power differentials should be disseminated, or how corporations or businesses should be run, because it's better if we run flat organizations and we have people that all have their say and their value. There's enough sentiment in that open space to really challenge the way they're structurally set up. So I say challenge the structures in which we are in our own spaces. Institutions is a big one. I know I'm facing my own personal life, facing a bit of challenging the academic institutions, because they have been perpetuating or creating these, especially in the gender equity space. I feel that even, for example, we're graduating more female residents and medical students than ever before. However, the institutions are still having a considerable gender bias and also contributing to gender-based violence. And so this is something in real-time situations I'm facing. And how do we change this power dynamic and this dominance control aspect of how learning happens, or how things are done and passed down within even the learning settings? How do we challenge that? And where do we go? And what kind of light do we shed on these institutions because they've been doing it this way for so long? How do we bring them into the space of really challenge them for what they're doing? And oftentimes what I'm dealing with now is coming from a harm reduction lens and really helping them understand, again, bringing self-awareness into this and making the invisible visible for some institutions, is that the level of awareness is so variable. And so creating opportunities where we can actually influence their decision making by challenging their lack of awareness, especially with regards to institutions. And this is a slow piece. This can be defeating some days because they are big entities. But trust me, if we have enough voices that are challenging them, even the big institutions have difficulty in answering to all of us. So it is our space and our place to be able to create that dynamic there. Challenging the status quo, and for those of you or may have heard me or know what I'm about, is definitely this. I think if we're not there to challenge it, it continues to serve so many people that it serves. But we know by challenging it, it'll serve that many more. And so consistently working in our arenas to chip away at this, and hopefully we'll see some dynamic change in the next decade, I'm sure. And leadership. So challenging leadership, just because someone has a position of power What does that mean? So challenging leadership to be accountable, to be responsible, and to make them understand and help them understand sometimes what they're contributing in this space. So they may be incredible leaders and may have done some, pivotal or innovative things in our spaces, and maybe giants in contributions to medicine as a whole or to the healthcare space. However, there's a lack of awareness into the harm they may be doing. And so that's where I challenge and nudge leaderships and leaders in general to think about, oh, how well are you doing on their, anti-racist or combating your systemic violence policies, or, bringing them into spaces where they may not be so comfortable, but it's very interesting and an opportune time to actually push people a little bit on where they stand. Status quo has to go. I do love the Honorable RBG, and um, to her comment about there'd be 9 men and nobody's ever raised a question about that. And that's exactly true. The status quo, if it's serving who it's meant to serve, then they're going to continue serving it without any guilt or without any shame. And so it's our opportunity and our challenge to consistently and constantly push. And so how are we going to do it? So I love the slide I created here, is that we see these mini powers, and we see a giant power. And so I'm a big fan of collective action. I'm a big believer that, all of us in individual visions and values aligned can create a substantive effort of power. And we have to remind ourselves, even in the space of government, elected officials, they're speaking to the people. They're working for the people. And if we can work for the people, genuinely working for the people, and all people, I truly believe that we've got a really big shot at doing all this work. And so, again, in my opinion, equity needs urgency, and we're the ones we've been waiting for. So it's our opportune time to lean into this space, to create our coalitions, harness our energies, making sure that we have a network that supports one another, to look at everything. And it's interesting, when things work in a system, usually they work the same way. So our academic institutions, whether you're in the US, whether in Canada, whether you're, in Sweden, they work very similarly, and how they've been set up are very similarly. So to dismantle a lot of the oppression and dismantle the systems, it's actually very similar in the toolkit, that we can apply it and to harness the efforts of everyone that's tired of dealing with the status quo, is really energizing everyone and challenging it on a global level. Again, we're all probably familiar with affirmative action and the need for it to challenge. I have this poster, and this is kind of how I live, and I still believe, my delusional optimist self, that we are able to radically transform the world, and you kind of have to embody that all the time. And I don't know if people will relate to the sentiment, but these are the things that keep me up at night. These are the things that keep me motivated to move. And now more than ever, knowing that there's a collective of people that are restless in this space, that are, before the learned helplessness sets in, I truly believe the next year to 2 years is the most opportune time that we've ever seen in this world, because we've got such violent opposition and we've got such extreme rhetoric that's existing in the world. This is the time to harness our collective efforts. If you look throughout history, if you look at the movements, whether it's the civil rights movement, or if you look at Gandhi's Salt March, or you look at other times and where there was dramatic change, there was a polarizing effect in the space. And if we just ask people to lean into one another or lean into ourselves from a human consciousness level, and whether that's bringing them together through art, through literature, through open spoken word, through education, through evidence, it's really calling on people's natural humanistic factors and to really work in that realm to be able to create the impetus for change. And I believe that these systems, we talk about healthcare equity, but justice is equally, if not more important to challenge because that space is actually very inequitable when we look at it and challenging the systems. Why I bring education into it. Education is the key to disseminate large amounts of information and to think about this may be an extreme opinion, but when you think about children and going to school and the indoctrination of ideas, for example, and I'm a big champion of educational reform and for allowing us to participate with children at a younger age to be able to influence them to take their own self-care needs, for example. I have an extreme that I work on, the opioid crisis. People wouldn't understand how I take the opioid crisis and go upstream into working with young preschoolers, kindergartners, and K through 5. Why is that so important? Because the most important thing to learn and a tool for children as they're being raised in the environments they are is that they need to learn how to emotionally regulate themselves. If they have dysregulatory systems, we know that the likelihood of them doing drugs or trying drugs or needing drugs or substances or an addiction is very high. If they've not worked through their traumas, if they've not given a skill set in order to do skills like cognitive behavioral therapy, if we can teach kids on how to self-regulate and not self-harm and work their emotions out and help regulate themselves, then they're less likely to develop a concurrent disorder, which is self-medicating through substances because of the anxiety or because of the depression or because of the hyperactivity that they've experienced. So I think there are really ways that we may want equity in one space, but if we go at it, all three of them, and understand how they kind of layer into one another and bridge into one another, that's how we can create such a systemic change. Those are my key messages for this today. I'm so excited to talk to all of you in more of a dialogue and understand what you're facing, and we can get a little bit more granular if needed, and exactly how, I've leaned into spaces to really disrupt some spaces, and but I'm happy to take questions.
Thank you so, so much, Dr. Sanj. It's been such an honor to have you speak and also to learn from